Today we're going to talk about sclerotherapy, which is the treatment of varicose veins, those spider veins that appear in the legs, the vascular spiders. The problem of spider veins is quite common. It occurs in more than 70% of women and more than 20% of men. Those veins do nothing for your leg. They only make your leg look ugly and you feel pain and their feeling of heavy leg. Hi, this is Dr. Lucas Brazil. I have the largest YouTube channel in the world about trichology with over 108 million views. Here to bring information and tips about hair loss, skincare, aesthetics, and health to the whole world, I create a version with videos in English. Welcome and enjoy. Spider veins has a very important genetic factor, and another factor is staying up a lot, increasing the hydrostatic pressure in the lower limbs. Then everything makes the blood go down and does get back. It ends up creating the spider veins. For example, pregnancy also reduces the blood return, and that makes the varicose veins, which appear slowly in the legs. The treatment of sclerotherapy aims to make it sclerosis of the vessel, which is to destroy the wall of the vase, causing one of the approach the other, and it kills slowly. There are several different types of products to make sclerosis, and the result depends a lot of the type of the sclerosing agent, the liquid that is injected in the spider vein. There are some that works faster, others slowly. Some are safer and others are more likely to make stains on the skin. Your doctor will choose the best sclerotherapy agent. Basically, one of the most used sclerosing agents is the hypertonic glucose, which is the water with sugar in a high concentration. Hypertonic glucose is good because it does not cause allergies. It has a low chance of pigmentation and the body reabsorbs, because the glucose is something that is part of your body. During the treatment of sclerotherapy, there is no miracle. You have to do several sessions. One session will never solve it. It's usually indicated from 7 to 10 sessions to have a nice results, and the result starts from the second or third session, and you realize that throughout the session some will disappear, others will get a little weaker, and some will persist. That's why your doctor needs to follow up and check you for more applications. And like all treatments for women, sclerotherapy also causes pain. When you go for hair removal, it hurts. When you go to remove your eyebrow, it hurts a lot. Sclerotherapy is painful too. When the liquid enters the vessel, it ends up causing pain. Even if anesthetic or ice is used to cold it, it ends up causing pain. There's no other way. If you choose to start the treatment over the winter, it hurts more because the skin is contracted in winter and it ends up hurting more. So a tip. If you're going to this session, go for warmer paint so that skin doesn't get tight and doesn't hurt so much. Men also have varicose, but the men ends up not caring. The hair hides, they do not treat. But men needs treatment too. With the treatment of varicose veins, those legs vessels start to improve, and then you start to have less pain, you feel less weight on your leg at the end of the day. As the vessels destroyed, the blood that was stained on the skin begins to flow into a vein that really works, and that vein will start to carry the blood that was stained there in the leg. There are people who have already had the treatment, but then they get a little upset because they see that the varicose veins come back, but in fact they don't come back. What happens is that the new lesions may appear, but the sclerotic vessel does not return. The application technique is very quiet and safe. It's done in the medical office at the same day the person goes home. The doctor applies the liquid in a very small needle inside the vessel to make the vessel sclerosis. As we said, it hurts a lot. Unfortunately, there are injuries that the more it hurts, the more efficient it is. That's it, the liquid enters that vessel and spread through collateral vessels, so it gives a little pain, but always remember that it's getting better. And because it's a needle treatment, you get a little swelling, you leave the session with the bite mark and with a little swelling, a little edema on the spot. And some regions are more painful than others, especially where the skin is thinner, for example the back of the knee, feet and ankle. After the procedure, it is recommended not to do much physical exercise, such as gym, running, fighting, cycling. You can do it on the day, but you can do it in the next day. But it's good to avoid depending on how sessions goes. Avoid strong physical exercise for up to 1 week. Because when the bite is done, there's a little bit of blood. If a very intense exercise is done, the blood can pass through the skin and generate a stent. After the application, it causes a little itching in the place. It gets a little burning and it lasts more or less from 7 to 10 days. The treatment is not immediate, it will get swollen and red and painful after 7 to 10 days, which improves the swelling and you start to see the first results. It's also very important not to sunbathe while undergoing treatment, because if this blood leak occurs, it makes a stain. Winter is a very sensitive period, as it is colder, the person will not get sun and will not have the chance of skin stains due to the sun. Another interesting factor to do in the winter is that as the several sessions, around 7 to 10 sessions with an interval of 15 days, until the end of the winter the legs will be beautiful to arrive in the summer. Another thing that you have to avoid after the procedure is to do massage and waxing, because the area will be inflamed with a little swelling, so anything you do and does the damage the skin cannot do. On the side effects and complications of sclerotherapy, they are quite rare. It depends a lot on the technique of application, the product used, the care after the procedure. In general, if it is done with a quality product and appropriate technique and the person really takes care of it afterwards, there are no complications. One complication that can happen is allergy to the injected product, but if hypertonic glucose is used, it practically excludes the risk. Another complication that can happen is hyperpigmentation, which can happen due to leakage of blood or because of inflammatory at the site. The use of hypertonic glucose also greatly reduces the risk of this complication, and if it occurs, treatment can be done with whitening with peeling, which will improve. If care is not taken regarding cleaning the area after the procedure, a skin infection may occur. The doctors make the application in a vase and he'll put a tape to protect, and then also use elastic stocking to make the blood return more efficiently. So if you take good care with tape, wash your leg well and take care not to get in the swimming pool, not to wear inappropriate clothes, not to get infected, but it's also a very rare complication, difficult to happen and easily treated. It can also happen in some case, something called cloud, which is you end up with varicose and around the other small vessels appear. There are several theories with why this happens. One is that end up forming these vessels to suppress the varicose, but it also can be solved during the treatment. If you like the video, make sure you subscribe and ring the bell to receive our new videos every week and leave your comment. Follow us on Instagram and Facebook, we have many other tips there too. Would like to know more about the products, check the description and visit our website eclairworld.com. Thanks for watching, and Dr. Lucas Brazil, see you in the next videos.